Good day, I'm Michal Pastrana, and I'm joined by my fellow researchers Phoebe Posecion, Riana Rexine and Cassandra Spencer, and we are Group 4A of BSN 3C. We are here to present our research entitled Lived Experience on Blended Learning Among Nurse Educators.
To begin with, the purpose of the study explored the lived experience and blended learning among nurse educators. The significance of this study is of great importance as it may contribute insightful perspective and theory into instructors' lived experience of their effectiveness or struggles while practicing and utilizing the blended learning modality in a classroom setting.
The methods of the study include the research design, instrument, and sampling. For the research design, the researchers utilized a qualitative research methodology of hermeneutical phenomenology to discuss and explain the perceptions of nurse educators in blended learning with the data gathered. For the research instrument, the primary instrument utilized was a semi-structured interview guide which was approved by the guidance counselor. For the sampling, the participants are nurse educators with a evaluation service that have experience being an instructor during blended learning. There are a total of 6 participants. 2 participants with a length of service of 1 to 5 years, 2 participants with 5 to 10 years, and 2 participants with 10 to 20 years or above. With the inclusion criteria of nurse educators who have experience being an instructor during the use of blended learning modality, are any age, any sex, have a master's degree in nursing, are single or married, and have been a nurse educator for at least 1 year.
After data gathering and analysis, the following themes were established. Theme 1, comparing blended learning to traditional face-to-face. Theme 2, challenges encountered during blended learning. Theme 3, benefits of blended learning to nursing education. Theme 4, evaluating students' performance during blended learning. For Theme 1, comparing blended learning to traditional face-to-face, the following insights were notable. Firstly, full face-to-face as preferred teaching modality. The majority of the participants focalized a preference of full face-to-face over blended learning as they felt as though it is more effective. As quoted by the participant, nursing is for full face-to-face. Secondly, academic integrity of students during online setting. In a face-to-face setting, academic integrity is more easily enforced, whereas online, it is harder to implement those standards. Therefore, there's a higher incidence of academic dishonesty when blended learning is in an online setting. As quoted by the participant, if you really are determined to cheat, you can really cheat, no? How much more online? Lastly, increased acquisition of skills during an actual face-to-face setting. In face-to-face, students are more receptive and are more likely to improve their nursing skills. If classes are online, the method of teaching is through lectures, which lacks hands-on experience needed for improving skills. As quoted by the participant, the disadvantage is you can't acquire the skills needed, especially if you're in the BSN program.
For Theme 2, challenges encountered during blended learning, the following are the most significant insights. Firstly, difficulty to simulate related learning experience and clinical exposure. The nurse educators voiced that if related learning experience and clinical exposure is set online and through simulation, it makes it difficult for the student and the instructor. The student will not be able to learn to their full potential, and the instructors have to fully simulate the hospital or clinical setting fully online. As verbalized, it's really hard to teach online. The learning requires skills, it requires assessment, clinical eye, and clinical judgment. Secondly, struggle to engage students during an online setting. In an online setting, classroom management is difficult to incorporate because instructors cannot control or fully grasp the attention of their students. This may be due to inattentiveness, other gadgets, or other distractions. As stated, because on online, you cannot practice your skills and the attention span of the students during blended learning. If it is online, it's totally different. Lastly, initial hurdles faced during the transition to blended learning. The instructors shared their experience with the initial adjustment period to blended learning and their difficulty adapting to the new modality that integrates more technology compared to full face-to-face. As stated, at first it was very, very awkward to me with this technology. You know, I'm old already. I'm not used to this technology.
3. Benefits of blended learning to education. The following are the most significant insights. Firstly, flexibility of blended learning. Blended learning created the benefit of having flexible class modalities. In times of natural calamity or cases where face-to-face is unattainable, Online learning can be used as a fallback to ensure teaching and learning does not stop. As stated, at least we already have the idea. With this kind of platform, especially in Canvas, and especially if there is calamity that will happen and you cannot go to school and also your professors, at least we are already prepared. Next, improve student-educator interaction. Benefits of face-to-face during blended learning is that students and instructors can build a better relationship as there is a physical aspect. Seeing and meeting in real life builds more rapport between students and instructors. As stated, I still go for face to face again. It's better that you see your students, their reaction, and then you can have feedback right away. For the last theme, theme 4, evaluating students' performance during blended learning, the most notable insights are first, enhancing students' learning by giving supplemental work. Instructors found that assigning supplemental work, such as assignments and post-tests, allows for the students further learning, whether it be through face-to-face or online modality. As stated, so how will you able to evaluate what they know? And of course, through giving post-tests or giving situational tests and with multiple choice. Lastly, responsiveness of students to spontaneous teaching. Evaluating students by asking them questions on the spot, whether online or face to face, allows for the instructors to gauge the learning of the students. As stated, so what I really want is to ask the students directly regarding how do they understand my lesson. For example, in order for me to gauge if they are really listening.
In conclusion, blended learning, one of the teaching models, makes traditional methods of teaching with online courses for achieving specific learning goals. Data was collected by doing live Zoom video conference calls or face-to-face interviews with participants who were chosen according to their rank of service as a nurse educator. It is concluded that online and face-to-face activities, when compared, have different levels of academic performance, and that nurse educators would rather assign activities online and do online lectures, but engage in discussion, tests, skill stats, and clinical exposure in a face-to-face setting.
The recommendations made by the researchers are as follows. For nursing educators, they are encouraged to use multiple types of instructional materials, trying new teaching techniques and various assessments when teaching via blended learning. For future researchers, further and more studies may need to be done on the lived experience of blended learning among nurse educators to explore the topic more and learn more as compared to previously discussed. For nursing students, they are encouraged to be patient with their clinical instructors during blended learning. It may be kept in mind that every person in the education community is adjusting to the blended learning modality. And with this comes the end of our presentation. Thank you so much for listening, and God bless.